Hello, you are most welcome, ladies and gentlemen, to today's tutorial. Today is going to be a quick tutorial. We want to actually try and do a quick recap on the muscles that we've looked at in the anterior compartment, yes, medial and of course posterior compartment of the thigh. Now, what happens is that yes, usually if it's a longitudinal section like those ones we've seen already, then the difficulty is quite less. Okay, you're able to find your way out. But if it's a transverse section, because we don't anticipate where the muscles are going to be, then we tend to have some difficulty. So it means that for you to actually be able to appreciate the muscles, okay, in a transverse section, then what happens is that yes, you have to know your lateral aspect, you have to know your medial aspect, of course posterior, and of course anterior aspect. You have to also have some neurovascular structures which will guide you, okay, in actually helping you to locate where the muscles are going to be. So it means that you should anticipate which muscles are going to be superficial, which ones are going to be more deep. Okay, so all these ones are actually going to help you in actually deciphering whether you are looking at the muscles of the anterior compartment, medial compartment, yes, which ones are deeper and all that. So as you can see, there's actually a transverse section through the thigh, somewhere in the mid portion of the thigh. Okay, and one thing is that it's more closer to where we have the femoral triangle actually. Now what we find is that yes, how do you know which muscles you are dealing with? Now I told you that there were some four muscles which were forming most of the bulk of the anterior compartment of the thigh. Okay, so as you can see, these ones are really bulkier compared to these ones, which you can see they are a bit scattered. So right from the start, then I know that this side is actually the anterior aspect of the thigh, so that this area becomes actually the posterior aspect of the thigh. Okay, again you get to know that the femur, okay, bone of the thigh, okay, you can appreciate that it's more closer to the anterior aspect than to the posterior aspect. Okay, that's another one thing too that you can actually appreciate, because you can feel, if you feel your own cell, you get to know that yes, there will be a lot of muscles over here, but if you come this way, you're able to actually appreciate it better compared to if you want to appreciate it from the posterior aspect. So it tells you that this is actually the anterior aspect. But remember, the muscles are quite bulkier, okay, they are quite bulkier, as you can actually appreciate a lot of muscle mass over here. But here, yes, although the space is larger, you tend to see that it's not that bulkier, forming that strong bulky area compared to this what we find over here. Now having seen that this is going to be the anterior aspect and this is going to be the posterior aspect, then this is the bone, that's the femur. Okay, then one other thing too is that you have to know whether which part is the lateral aspect and which part is the medial aspect. Now remember, when we looked at the superior medial portion of the anterior aspect of the thigh, we saw that there were some neurovascular structures. Okay, we saw some neurovascular structures, okay, in the femoral triangle. Okay, so this area will represent the femoral triangle, okay, this triangular shaped area, so that we see those structures over there. Now remember that there were some structure, three main structures that I mentioned. So there was a femoral artery. Okay, so if you want to go from lateral to medial, there was femoral artery, there was what we call femoral vein, and of course the femoral nerve, okay, was the most medial structure. Then of course you get the lymph node of Okwan, of course in the the femoral canal. Okay, remember that these two are in femoral sheath. The femoral nerve will not be in femoral sheath, although we don't find the femoral nerve here, but at least we can see these two neurovascular structures, femoral artery. So the artery is more lateral and then the vein is more medial. Okay, so it tells you that yes, as you move this way, then you are going to the lateral aspect, but as you come this way, you are going to the medial aspect. So it means that this is the medial portion of the bone of the femur, and this is the lateral portion of the femur. So once we've established this, then we are clear to go. So this is the anterior aspect of the thigh. And the anterior aspect of the thigh, I told you that the most lateral structure that we are going to find over there will be the rectus femoris muscle. Now remember, this one we are actually taking it from a bit higher level, a bit, getting closer to the femoral triangle area. So I told that the most lateral aspect, okay, because we know there's the lateral aspect, we have this to be what we call the rectus femoris muscle. Okay, rectus femoris muscle. Now remember that I told that this rectus femoris muscle is actually superficial. Okay, so that deep to this rectus femoris muscle, we will get what we call the vastus, intermedius muscle. Then once we are able to identify these two, then it tells us that we will actually have, yes, if you come here, okay, then we have this muscle over here known as the vastus lateralis muscle. Okay, so that is the vastus lateralis muscle. Then we know that over here, the medial aspect, you have what you call the vastus medialis muscle. But remember, there is another muscle which actually, yes, forms actually the the lateral boundary of, its medial border forms the lateral boundary of what we call this triangle, okay, which is the femoral triangle. Okay, so this muscle is known as the sartorius muscle. It's still part of the anterior compartment of the thigh. Remember that that's the longest muscle in the human body. So that is the sartorius muscle. Okay, so that's one thing that you have to know to be able to identify the muscles in the anterior compartment of the thigh. Okay, now if we get to the medial compartment of the thigh, okay, by the way, in the femoral triangle, yes, you can see that just before I get to the femoral triangle, there will be a septum, which we call it the medial intermuscular septum. Now this septum is actually separating muscles of the anterior compartment of the thigh from muscles of what we call the medial compartment of the thigh. Okay, so that is what we are going to find there. But remember that in this femoral triangle, now you can see the femoral artery laterally placed, femoral vein, yes, being medial. Then there are some two nerves that we saw. Okay, we saw the saphenous nerve, the longest cutaneous nerve, yes, of the lower limb. Okay, so look at it now. The saphenous nerve is just medial to what we call the nerve to vastus medialis. Now we saw nerve to vastus medialis, so please go and visit that video of actually where I explained that of the femoral triangle. Actually look at the anterior compartment of the thigh. Okay, so look at that one. So that's how the structures are, but they will actually lie anterior to what we call the femoral artery and the femoral vein. Okay, the saphenous nerve and nerve to vastus medialis muscle. So that's the vastus medialis muscle nerve that will supply it. Okay, now if you look at, now before I come here, now what happens is that now you can see this vein, which is the long saphenous vein or the great saphenous vein. Now this vein, now when we look at layers, okay, actually when we look at the roof of what we call the femoral triangle, we saw that there was actually superficial fascia, okay, which will be deep to the skin. And within the superficial fascia, one of the contents that we are going to find over there will be the great saphenous vein. So that will actually be subcutaneous. Okay, subcutaneous. Okay, so look at that one. Appreciate it over here. Now, so in the medial compartment of the thigh, okay, I told you that the most medial structure in the medial compartment of the thigh, okay, was the gracilis muscle. So this is the gracilis muscle, is the most medial structure in the medial compartment of the thigh. Okay, so that is what we are going to find over here. Now again, we saw that actually from superficial to deep. Okay, superficial, so as you come more closer to the skin in the medial aspect, then you are getting more superficial. So from superficial to deep, we saw this muscle known as adductor longus muscle. Adductor longus muscle. Okay, that's the adductor longus muscle. And then behind that, just behind that, we have what we call adductor brevis muscle. That's the short form. And then even posterior to that, we have what we call adductor magnus muscle. Adductor magnus muscle. Okay, now remember that, of course, the femoral artery and of course femoral vein will have some branches, some deep branches, and of course some deep tributaries. Okay, so these tributaries will be in the medial compartment. They will actually give off some branches. For instance, the femoral artery, the deep artery of the femur, the femoral artery, that's the profunda brachii artery, profunda femoral artery, or the deep artery of the femur. Okay, will actually give off some muscular branches or some motor branches, okay, to actually supply the various muscles. So will actually also lie over here. So as you can see it over there, as well as of course the deep femoral vein over here. But in any case, this deep artery of the thigh is actually a branch of what you call the femoral artery. Now, of course, this deep artery, this vein, okay, will actually drain into what we call the femoral vein. So that's what we are going to find over here, okay, regarding muscles in the medial compartment of the thigh. Okay, so these are the muscles that you are going to see when you take that transverse section over here. Now, for the posterior compartment of the thigh, okay, now remember that I told you that laterally, okay, so as you move this way, then we are going laterally. Now laterally, we are going to have what we call the the biceps femoris, having two hairs. So more laterally, okay, we are going to have the short head of biceps femoris muscle. Okay, and as you come deeper, okay, this is quite substantial compared to this one. Will be what we call the biceps, the long head of biceps femoris muscle, long head of biceps femoris muscle. And then of course, now I told you that sandwich between the biceps femoris, the long head of biceps femoris, and of course what we call the membranosus, okay, semimembranosus muscle. Now this is actually semimembranosus muscle. Semimembranosus muscle, I told that is deep to what we call the semitendinosus muscle. But as you descend, what happens, just very proximal portion, what happens is that this one, the semitendinosus, is sandwiched between the long head of biceps femoris muscle and that of semimembranosus muscle. But because this one is taken at a bit lower section, you can't actually appreciate that organization. But what we can appreciate over here is that as you come more medial, what happens is that the semimembranosus and semitendinosus will be there. More laterally, we are going to have this the biceps femoris. Medially, semimembranosus and semitendinosus. But I told you that the tendon of semitendinosus will lie on the belly of what we call membranosus. So it tells us that semitendinosus will be superficial to semimembranosus, which is deep. Okay, so that is what we are going to see over here. Now, I told you that the nerve which will supply most of these muscles in the posterior compartment, that the hamstring muscles, will actually be what we call the the sciatic nerve, which will later give off the tibial branch and of course the common peroneal branch. So that is actually what we are going to see. So for you to actually be able to appreciate transverse section, you have to anticipate how the structures are organized, okay, so that you'll be able to know, so that you get your directions very clearly. All right, I hope you find it helpful, and we hope to do more of these transverse sections, okay, in our later sections. So Thank you very much, and may God richly bless you.